Hello and welcome. If you're a parent and you're getting ready for your child's adenoidectomy, I know it can feel like a really big deal. That's exactly why we've put this guide together, to walk you through everything step by step so you feel confident and ready for what's ahead.
So does this sound familiar? That nightly snoring, the tossing and turning? Maybe you've noticed your child is always breathing through their mouth. Well, these are more than just little habits. They're actually signals. So let's dive in and figure out what's really going on, and more importantly, how we can fix it. To really get to the bottom of this, we first need to talk about something called adenoids. Now, you've probably heard the term thrown around, but let's get super clear on what they are and why they can sometimes be the root of the problem. This picture pretty much says it all, doesn't it? On the left, you see a nice, clear airway, easy for air to get through. But look at the right. That enlarged adenoid is physically blocking the back of the nose. It's literally like a roadblock for air, and that is what causes all that snoring and mouth breathing. So what exactly are adenoids? You can think of them as little security guards for your child's immune system, just hanging out at the back of the nose. They're actually there to help, trapping germs and fighting infections. But sometimes they can get a little too good at their job, become too big, and that's when they start causing trouble. And when they do get too big, you'll start to notice some pretty clear signs. We're talking about that constant snoring, restless nights, and it can even lead to things like ear infections that just keep coming back, or a nose that always seems stuffy. If you're nodding along to this list, you're in the right place. Okay, understanding the problem is one thing, but knowing your child is in the best possible hands, that's everything. So let's talk about the expert who will be guiding your child through this, because having that trust is so important. Your child is going to be cared for by Professor Dr. Ahmed Nofal. Now, beyond his incredible credentials from the Royal College of Surgeons, he's the head of the ENT department at Ream Hospital. That means he is a true leader in this field, specializing in exactly what your child needs: pediatric care using the most modern, gentle techniques available. And get this, he has performed over 4,000 advanced surgical procedures. That isn't just a number. That represents thousands of kids breathing and sleeping better, and thousands of families just like yours who put their trust in him. That kind of experience is just priceless. Now, let's talk about the surgery itself, because we're not talking about some old school method here. Dr. Nofal uses a really advanced technique that's designed to be as gentle and as effective as possible for your little one. Just look at the difference. The modern ablation technique, on the left, uses low-temperature energy to gently dissolve the tissue. It's a world away from older methods that involve scraping. So what does this mean for your child? It's simple. Less pain after surgery and a much faster recovery. They'll be back to being a kid in no time. So what does the procedure actually look like? Well, it's incredibly quick. First, your child will be comfortably asleep the whole time. The surgery itself, usually only about 15 to 30 minutes. And here's the best part for parents, it's all done through the mouth, which means absolutely no cuts and no stitches on the outside. All right, now that you know the what and the why, let's get practical. Feeling prepared for surgery day can make a world of difference for both you and your child. Let's make sure you know exactly what to do. Here's a super simple checklist. The fasting rules are key. No food for 8 hours and no water for 2 hours before. Make sure you tell the doctor about any medications your child takes. And, simple things can make a huge difference, like dressing them in comfy clothes and definitely bringing their favorite toy or blanket. And here is probably one of the most reassuring things you'll hear. This is not some long, drawn-out hospital stay. The vast majority of kids are checked over in recovery and get to go back to the comfort of their own home on the very same day. So the surgery is done and you're heading home. The journey isn't quite over, but the next part is all about rest and recovery. Let's go over a few simple things you can do to make sure your child's healing process is as smooth and comfortable as possible.
Here's your game plan for at-home care. The number one rule, and I can't stress this enough, is hydration. Lots and lots of fluids are key. Start with soft foods like yogurt or ice pops, plan for some quiet time with movies or books, and make sure to use the pain relief medicine as prescribed to keep them comfy.
It's also really helpful to know what's normal during healing, just so you don't worry. A sore throat for a few days, maybe a bit of bad breath, or even a mild fever for a day or two. These are all totally normal signs that the body is healing. You might even hear some snoring for a bit because of swelling, and that's expected too. Now, for your peace of mind, let's be super clear about when you should call for help. If you see any heavy, bright red bleeding, if a fever is high or just won't go away, or if you see signs of dehydration, don't hesitate. Pick up the phone and call your doctor right away. And remember, help is always just a phone call away. The amazing team at Ream Hospital is there to support you through this whole process. So keep this number handy, and please never hesitate to reach out if you have any questions or concerns at all. At the end of the day, this journey is all about trust. Trust in your expert surgeon, trust in this gentle procedure, and trust that you are making an incredible decision for your child's health. You're opening the door to better breathing, restful sleep, and a healthier, happier kid.